everyone. Welcome to today's presentation, which is part of a series of webinars provided by the Division of Public Health, Section of Chronic Disease Prevention and Health Promotion. Our work focuses on chronic disease and injury prevention, as well as data collection and surveillance. This webinar series was created to provide a way for us to talk about our projects and explore how we can work together. We will be offering webinars on the third Tuesday of every other month at 1 p.m. There are a few housekeeping items to go over before we start. If you are listening by phone, please keep it on mute. Please do not put this call on hold. If you receive a call, please hang up and call back in. The webinar is planned for 30 minutes, a 20-minute presentation followed by 10 minutes of questions and answers. A recording of today's webinar will be sent to all participants, and the slides will be made available online soon. Audio will be coming through your computer. You also can call the number provided. If you need help listening to or watching this webinar, please let us know. To ask a question, you will need a microphone or you will need to call into the number provided. Please hold questions until the end of the presentation. We will now start today's webinar.
Welcome and thanks for attending today. I'm Janice Gray, the Nurse Consultant for Heart Disease and Stroke Prevention in the Section of Chronic Disease Prevention and Health Promotion with the State of Alaska. I'm going to provide an overview of our Hypertension Control Project with the Eastern Aleutian Tribes Community Health Centers and the Alaska Primary Care Association. This project was funded by a grant from ASTHO, the Association of State and Territorial Health Officials. During this presentation, I'll provide an overview of the project, review Alaska hypertension data, provide an overview of the Quality Improvement Coaching Framework, review the initial aim statements and team strategies, and describe successes and challenges. This map shows the locations for the 8 Eastern Aleutian Tribes clinics. The EAT service area spans about 100,000 square miles, close to the size of Colorado. The clinics are located in Adak, Akutan, Cold Bay, False Pass, King Cove, Nelson Lagoon, Sand Point, and Whittier. I want to give you an idea of the problem of hypertension in Alaska. So in the next few slides, you'll get a glimpse of how widespread hypertension is for us. On this graph, you can see that 30% of Alaskans report having high blood pressure, which is comparable to 31% nationally. This slide shows some of the disparities between some groups in the state. These data are from a single year, 2016. For this year, differences in hypertension prevalence by sex are not significant. For race, Black or African American is significantly higher than white, but not Alaska Native. The older population has significantly higher prevalence of hypertension. For poverty, hypertension similarly affects all income levels. These data are for the Aleutians East Borough, where most of the EAT clinics are located. Because the numbers are so small, this graph includes 10 years of data. Again, since the numbers are so small, this difference in women's hypertension rate between the Aleutians East Borough and the rest of Alaska is not statistically significant. This graph of hypertension risk factors also includes 10 years of data. The rates for smoking and binge or heavy drinking are significantly higher in the Aleutians East Borough compared to other regions of Alaska. This project involved many Alaskan and national partners that include Eastern Aleutian Tribes, the Alaska Primary Care Association, the State of Alaska Division of Public Health, the Association of State and Territorial Health Officials, Alaska Native Tribal Health Consortium, the National Indian Health Board, CDC, and the Center for Healthcare Strategies. These are the learning collaborative goals on which ASTHO based the work for this project. To improve hypertension control and prevention, increase the percentage of patients with a diagnosis of hypertension, identify and build networks to control hypertension, test models for collaboration between partners, and use a quality improvement process to affect practice and policy. These are the 6 key themes identified by ASTHO to lead to lasting success. Build partnerships, use data, standardize practices and protocols, gain support from leadership, payers, and policymakers, incorporate successful strategies, and leverage other statewide initiatives. Currently, the state of Alaska is working on several hypertension control efforts with the Alaska Primary Care Association, Alaska Medicaid, CMS, ASTHO, the Center for Healthcare Strategies, the CDC, and others. This project models its QI processes from the Institute for Healthcare Improvement using the Model for Improvement as the framework. The coaching incorporates quality improvement process training as well as evidence-based practices on improving control of hypertension. The Alaska Primary Care Association facilitators also incorporate team-based coordinated care and patient-centered medical home certification guidelines. The aim statement clearly defines the problem you are trying to solve. Ideally, the aim statement is SMART. It should be specific, measurable, achievable, relevant, and time-bound. These 2 aim statements were drafted during our first in-person team meeting that included all of the Alaska and national team members. These statements formed the framework for the work that followed. The patient-focused aim statement is, by June 30th, 2018, among active patients 18 to 85 years old in the EAT clinics, improve the percent of patients whose hypertension is in control and reduce the percent of patients with elevated blood pressure who have not been diagnosed with hypertension by 10%, each through improved medication and hypertension monitoring access and team-based care. The systems level aim statement is by June 30th, 2018, improve access to affordable medications for rural and remote Alaskans through partnerships. At the first in-person meeting, we created 4 project teams. Eastern Aleutian Tribes clinical team, primarily focused on the hypertension control processes. The Eastern Aleutian Tribes billing and administrative team, primarily focused on retrieving hypertension data from the electronic health record. The Alaska Primary Care Association team, which provided quality expertise and created training curriculum in all of the clinics. And the State of Alaska Division of Public Health team, which focused on exploring how we can improve access to medications and obtain certification and reimbursement for community health workers. These are the strategies the EAT clinical team drafted at the first in-person meeting. Create a universal protocol for hypertension management. Enroll all patients in the EAT electronic health record who are seen in outreach clinics. include blood pressure checks for all patients seen in the outreach clinics, map patient flow in all of the 8 clinics, train all clinic staff members to take blood pressures, and include blood pressure monitors in clinic waiting rooms for patients to use. These are some of the results accomplished after 12 months of the project. 2 hypertension protocols are being created for use in all of the EAT clinics, one for new and one for chronic hypertension patients. New hypertension registries were created in 3 of the EAT clinics. All clinic visits now include blood pressure checks at critical points in patient flow. EAT created a process to enroll all patients seen in outreach clinics in their EHR. All outreach clinics now include blood pressure checks for all patients. And patient flow was mapped in all EAT clinics, and 5 improvement points were identified in each clinic. The EAT clinical team also trained all appropriate clinic staff to accurately measure blood pressures, added blood pressure monitors to some clinic waiting rooms. We're seeking funding to purchase blood pressure monitors for community locations. We learned that Medicaid provides funding for covered individuals to purchase home blood pressure monitors, and purchased a learning management system, and information was loaded into that system for tracking and providing training for all EAT clinics. These are some of the activities that are continuing to be worked on and developed to complete final versions of the new and chronic hypertension protocols, create hypertension registries for 5 additional EAT clinics, to secure funding to purchase blood pressure monitors for community locations, expand the use of the learning management system, and to institutionalize accurate blood pressure measurement training into a system of ongoing training. These are the strategies the EAT billing and admin team drafted at the first in-person meeting to create electronic health record reports that include patients with diagnosed hypertension, controlled hypertension, uncontrolled hypertension, and elevated blood pressure with no diagnosis of hypertension. The EAT billing and admin team has provided clinic-specific data for all 8 Eastern Aleutian Tribes clinics during the project. This allowed the clinics to measure their progress before the EHR reports were created. They provided these data by manually pulling every patient record and compiling the data by hand. They also partnered with the Alaska Native Tribal Health Consortium to create EHR clinical reports, and we are currently finalizing the accuracy of those reports. These electronic health record reports from Cerner will be able to be run in all EAT clinic sites. And all EAT clinics are currently creating a dynamic work list. These are the strategies the Alaska Primary Care team drafted at the first in-person meeting to identify content for team-based care, quality improvement facilitation training, with content aligned with the patient-centered medical home, PCMH content. Develop a hypertension algorithm in collaboration with Eastern Aleutian Tribes in the state of Alaska. Develop trainings for on-site, in-person, virtual, and for community health worker apprentices, including roles and responsibilities. Develop a training schedule for all 8 EAT clinic sites. Identify and develop measures and goals for the EAT system, individual EAT clinics, and the Alaska Primary Care Association. Deliver and evaluate the training, and research options for pharmacies and improving access to medications. These are some of the results accomplished by APCA after 12 months of the project. They identified and developed measures and goals for the EAT system and the individual EAT clinics. They created, delivered, and evaluated team-based care, PCMH, and QI training to all 8 EAT clinics, and developed training curriculum for on-site, in-person, virtual, which also incorporated testing of the new learning platform, and for community health worker apprentices, including their roles and responsibilities. APCA also enhanced huddles, included more staff members, having patient information available for who's coming in and why. They were able to use clinic-specific data to show progress, and they are developing a hypertension algorithm in collaboration with EAT and SOA. And they're researching options for pharmacies and improving access to medications. These are the strategies the State of Alaska Division of Public Health drafted at the first in-person meeting to explore how the 340B program can support improved access to medication. The 340B drug discount program is a U.S. federal government program that requires drug manufacturers to provide outpatient drugs to eligible healthcare organizations and covered entities at significantly reduced prices. We also try to explore options with private pharmacies, determine what supports or barriers exist within Medicaid regarding medication access, to convene stakeholders to address certification and reimbursement for community health workers, and to identify other root causes related to medication access and adherence. For medication access and payment research, we determined that the federal 340B program was not a viable option for many of the FQHCs. In fact, most had dropped the program. For Medicaid, we discovered that most antihypertensive meds are available with 90-day refills, and home blood pressure monitors are covered for Medicaid recipients. For community health worker certification and reimbursement, we were not able to identify a viable payment or reimbursement mechanism, and no certification mechanism was identified. We also found mail delivery barriers in some rural areas, but have not yet discovered systemic resolutions for the problems. Here are some data demonstrating the success of hypertension control efforts Eastern Aleutian Tribes implemented during the ASTHO project. As you can see, the percent of EAT patients with their blood pressure under control has increased dramatically over the course of this project, from 8% before the beginning of the project to 57% by February of this year. The bottom table shows the number of patients identified as hypertensive with reduced blood pressure during a 2-month period. The percent of patients improved increased from 24 to 35%, illustrating the effectiveness of EAT's treatment efforts. Here are the Alaska team members who participated in the project. They're from Eastern Aleutian Tribes, the Alaska Primary Care Association, Public Health Nursing, and the State of Alaska Division of Public Health. Here's the contact information for myself, Patty Landuska with the Alaska Primary Care Association, and for Dr. Danita Kohler with Eastern Aleutian Tribes. I'd like to personally thank all of the partners who participated in this project. And this is a beautiful fall day in King Cove, Alaska. I'd like to thank all of you for joining us today And does anyone have questions?
So as we wait for questions to come in, you can type them in, or you can ask them over your phone or through the computer. But I'm going to start by asking Janice just to talk about what do you think the biggest change is that you saw in these clinics?
Hi, thanks, Anne. One of the things, I mean, this is from an outsider's perspective, but it was the ability and the willingness of the clinics to come together to work on one project throughout all of their sites, and just really the excitement of the staff to participate in this. It was really encouraging and amazing and just and very successful.
Great, thank you.
Hey, Janice. What are some of the next steps for this project?
Well, this project was very closely aligned with the quality improvement facilitation project that we have been working on for the last 3 years. And that project will continue into the future. So I guess really the way it'll move forward is to have additional clinics and additional SQHCs to participate in that quality improvement facilitation project that we've been working on statewide with the FQHCs. So any clinics that are interested in that, in this project or similar projects working with quality improvement tools and the processes that are in quality improvement, just contact us with the state of Alaska or the Alaska Primary Care Association, and we can put you into our next cohorts to work on projects.
Great, thank you, Janice. Any other questions coming in? Well, we waited just a tad longer. I'm just going to remind everybody that Janice's contact information is on this slide. Feel free to give her an email or give her a call if you have any questions about this project. We always upload our PowerPoints and our webinars to our CDPHP website, our chronic disease section website, which was also listed on the first slide of this webinar. Hopefully those will be up in the next week. And we also keep an archive of past webinars, and we will announce the next webinars for our upcoming fiscal year soon. So thank you very much for your time. We will be ending the webinar now. Thank you.